Hey, welcome to the PTCB Prep Guide. This is your go-to spot for making those tough pharmacy tech concepts super simple. And today, oh boy, we're diving into the endocrine system. This is a big one, and you're absolutely going to see this on your exam. And look, by the end of this, I promise you'll have a solid grip on the key endocrine disorders, their meds, and exactly how to link them to the PTCB. We're going to make this stuff stick.
Okay, so here's the game plan for today. We'll kick things off with the basics, then jump into the big three glands, thyroid, adrenal, and parathyroid, and we'll wrap it all up with a quick-fire review to really hammer it home. Just a heads up, we're not covering diabetes here. That's a whole beast on its own, and we've got a separate, super detailed explainer for it. All right, first things first, let's talk basics. Before we get into all the different disorders and drugs, you got to understand the system that's running the whole show, right? This foundation makes everything else click into place.
So, what is the endocrine system? Honestly, the best way to think about it is like your body's own wireless network. It's got these glands that shoot out chemical messengers, we call them hormones, to control pretty much everything. Your metabolism, your energy, how you deal with stress, you name it. And the problems start when those signals get either way too strong or way too weak.
Okay, let's dive into our first major player, and trust me, you will see this on the PTCB. We're talking about the thyroid gland. I want you to think of it as your body's internal thermostat, or maybe like the engine. It basically controls how fast or slow your metabolism runs. This slide lays it out perfectly. You've got two main problems. On one hand, you have hyperthyroidism. Think hyper, overactive. The engine is just revving way too fast because there's too much hormone. On the flip side, you have hypothyroidism. Think hypo, underactive. The engine is slowing down, it's sluggish, all because there's not enough hormone. If you can remember this simple engine analogy, the symptoms will make total sense.
So what happens when that engine is just redlining all the time? Well, exactly what you'd expect. Everything speeds up. We're talking about losing weight without trying, a heart that's racing, feeling shaky, those tremors, lots of sweating and anxiety. And then there's that really classic sign you might see, bulging eyes. That's a big clue for something called Graves' disease, which is a super common cause of hyperthyroidism.
Okay, so how do we cool down that overheating engine? We've got a few tools in our toolbox. The main strategy is to block the thyroid from making so much hormone. For that, we use drugs like methimazole. The brand name is Tapazole. In more serious cases, doctors might use radioactive iodine to destroy the overactive thyroid tissue. And for those symptoms, like the crazy fast heart rate, we can use a beta blocker like propranolol to help calm things down. All right, let's switch gears and talk about the complete opposite. Hypothyroidism. Remember, this is the engine slowing way down. So the symptoms are exactly what you'd imagine. Feeling tired and sluggish all the time. Gaining weight, always being cold when nobody else is. Even a puffy face and dry skin. It's literally the mirror image of what we just talked about.
So how do we fix it? Well, if the problem is not enough hormone, the solution is pretty simple. We just replace it. And the number one absolute rockstar drug you have to know for this is levothyroxine. Brand name, Synthroid. Let me say that again because it's that important. Levothyroxine, brand name Synthroid. It's just a synthetic version of the main thyroid hormone, T4, and it is the go-to treatment, for sure.
Okay, everyone listen up. This slide right here, this is PTCB Gold. This is a massive counseling point you need to know. Levothyroxine is super picky about how it gets absorbed. It has to be taken on an empty stomach. We're talking first thing in the morning with just water. And, this is key, it has to be separated from any supplements with calcium or iron by at least 4 hours. Why? Because those minerals will literally block it from working. I can almost guarantee you'll see a question about this.
All right, moving on. Next up, we've got the adrenal glands. Think of these little guys as your body's managers for two big things, stress and salt. And you know what? Just like with the thyroid, it really boils down to two main issues, and they both revolve around a hormone called cortisol. That's your main stress hormone. When you have way too much cortisol, that's called Cushing syndrome. And when you have way too little, that's Addison's disease.
So what does it look like when the body is just swimming in cortisol? Cushing's has some really unique signs. There's this specific weight gain right in the belly and the face. It gives people what's often called a moon face. But at the same time, their arms and legs can get really thin. It's a very distinct look. To treat it, you got to fix what's causing it, or you can use drugs that block cortisol production like ketoconazole.
Okay, now for Addison's disease. This is the opposite problem, right?
not enough hormone. So the treatment is exactly what you'd think. We replace what's missing. It's called replacement therapy. We give hydrocortisone to replace that missing cortisol, but that's not all. The adrenal glands also make a hormone for salt and water balance called aldosterone, so we have to replace that too. And for that, we use a drug called fludrocortisone.
All right, time for our last stop on this endocrine tour, the parathyroid glands. And listen, when you hear parathyroid, I want one word to pop into your head: calcium. That's its whole deal.
The logic here could not be more straightforward. The parathyroid glands make something called parathyroid hormone, or PTH. If you have too much PTH, it pulls a ton of calcium out of your bones and dumps it into your blood. The result? High blood calcium. And if you have too little PTH, well, that calcium stays locked up in your bones and you end up with low blood calcium. It's a direct cause and effect.
So, what's the big deal with having too much calcium floating around in your blood? Think about it. If the calcium is coming from your bones are going to get weaker. That can lead to pain or even fractures. And all that extra calcium has to go somewhere, right? A lot of it ends up in your kidneys, forming really painful kidney stones. Definitely remember that connection for the exam.
And speaking of the exam, here is an amazing little memory trick for you. The main drug we use to treat high calcium levels is called calcitonin. Just say it out loud: calcitonin in. It literally sounds like calcium in, and that's exactly what it does. It pushes calcium back into the bones. You use that little trick, and you'll never forget it.
Whew, okay, we have covered a ton of information, but now it's time to bring it all together. Let's do a quick, rapid review to really lock this knowledge in so you're feeling confident for exam day.
Seriously, screenshot this slide. This table is your ultimate cheat sheet. Let's just run through it real quick. Hyperthyroidism, too much hormone? We hit it with an antithyroid like methimazole. Hypothyroidism, too little? We replace it with levothyroxine. Cushing's, too much cortisol? We block it with something like ketoconazole. Addison's, too little cortisol? We replace it with hydrocortisone. High calcium, we lower it with calcitonin. It connects every single dot for you.
So here it is, the big takeaway. This is the mental framework you need. Think of it as a chain. What's the hormone? What's the imbalance, too much or too little? What are the symptoms of that imbalance? And what's the drug that fixes it? I'm telling you, PTCB questions are built around this exact logic. Master this flow and you'll be set.
Okay, let's put that logic to the test right now. Ready? A patient is taking levothyroxine and they're complaining about weight gain and being tired all the time. What's the condition? Take a second. You got it? It's hypothyroidism. See? The drug and the symptoms lead you straight to the answer. It works.
And there you have it. That's your complete, no-fluff guide to the big endocrine disorders for the PTCB. And don't forget, if you need to brush up on diabetes, we've got a whole other explainer just for that. The link is down in the description. If this helped clear things up for you, do me a favor and hit that subscribe button, share it with a friend, and drop a comment to let me know what topic you want to see next. Until then, study smart and go ace that exam.